So are you suffering from lymphedema? And why is it so worrisome? And exactly what is it and how do you treat it? Well, let's find out with Jennifer Fernandez, a physical therapy assistant and certified lymphedema therapist, and Michelle Haas, a physical therapist and certified lymphedema therapist, both from MarinHealth. This is the Healing Podcast, brought to you by MarinHealth. I'm Bill Klaproth. Jennifer and Michelle, thank you so much for your time. We really appreciate this. Jen, let me start with you. Could you give us a brief background on your professional experience?
Sure. Hello. My name is Jennifer Fernandez, and I have been working as a physical therapy assistant for over 20 years. I'm also a certified lymphedema therapist and have a specialty certification in orthopedics. And I've been working here in the outpatient department of MarinHealth Medical Center for the past 7 years.
All right, great. And Michelle, can I ask the same of you, if you could give us a brief background on yourself?
Hi, yes, of course. I am a physical therapist. I've been a physical therapist for over 20 years, and I'm also a certified lymphedema therapist. I've been here at MarinHealth for about 4 years. I currently specialize in oncology and lymphedema management, as well as women's pelvic health.
All right. Well, thank you both. And again, it's a pleasure to talk with each of you. Jennifer, let me start with you. Could you explain this to us just so we all are on the same page? What is lymphedema?
So let's first start with a little bit of information about the lymphatic system. So the lymphatic system is an important part of your immune system, and it's made up of a network of tissues and vessels and organs, and it has two main functions. The first one is to fight infection and to rid the body of toxins, waste, and other unwanted materials. And the second main function is to help maintain a fluid balance in the body's tissues. So now that we know a little bit about the lymphatic system, we can talk about lymphedema. And lymphedema occurs when the lymphatic system is not able to adequately drain the lymphatic fluid from a certain area of the body. And this leads to an accumulation of protein-rich fluid, which causes swelling. And this swelling is what we call lymphedema.
Okay, got it. Well, thank you for explaining that now that we have an idea of what that is. So, Michelle, let me ask you this. Are there different types of lymphedema?
Yes, there are two types of lymphedema, primary and secondary. So with primary lymphedema, there's a developmental abnormality of the lymphatic system, which is either congenital or hereditary. In this case, lymphedema can develop any time during a course of a lifetime, and it's rare. It affects 1 in 100,000 people in the U.S. Diagnosis is often made by a physician after excluding any general venous or secondary node disease. Secondary lymphedema is much more common. This affects 1 in 1,000 people in the U.S. The mechanical insufficiency present in secondary lymphedema is caused by a known insult to the lymphatic system. The most common causes we see for secondary lymphedema include surgeries such as removing lymph nodes or removal of breast tissue due to cancer, radiation, trauma, infection, malignant tumors, and chronic venous insufficiencies.
So then, Jen, because of the nature of lymphedema, the treatment must be very personalized based on the location of the issue and the patient's situation. Is that true?
Well, of course, we always personalize treatments based on the individual needs of our patients and how they present, and that could be different at every treatment. The treatment components will vary on things like the time elapsed since surgery, any precautions that are put into place by the surgeon, any restrictions in the tissue or the joint, the functional requirements of the patient, what the patient can tolerate, and the goals of the patient.
So then what are the treatment options?
So there's tons of different treatment options, and again, those are individualized based on the needs of the patient, but some of the common components when we treat a patient with lymphedema include manual lymphatic drainage, and this is a very specific light skin stretching technique that was developed by Dr. Emil and Mrs. Estradvater in 1936, and this specific technique helps to move the lymphatic fluid out of the area that has become swollen and direct that fluid to the functioning lymph channels and collectors that were not damaged by the surgery or insult to the area. We also use manual therapy to address tissue and joint restrictions, therapeutic exercise to address range of motion, strength, and stability deficits, Sometimes compression bandaging and or compression garments is indicated, and probably most importantly, patient education. And this will be on how they can reduce their risk of developing or progression of their lymphedema, healthy habits, and also on the things that they need to do in between treatments and then ultimately throughout their life once they're discharged from physical therapy.
Okay, and then Michelle, how is physical therapy used in the treatment of lymphedema?
Well, education about the lymphatic system is probably one of the major components of our PT. Many people come to us with a fear of developing lymphedema or without any knowledge of how to manage the lymphedema that they do have. So we teach the patient about the lymphatic system and what signs and symptoms to look out for. Early detection and treatment is very important. If lymphedema is caught in the earlier stages, it can be reversed. But once lymphedema has progressed to stage 2 or further, it's no longer reversible and it has to be managed so that it doesn't worsen. So we evaluate for the presence of lymphedema by taking circumferential measurements, the limbs. We assess skin and tissue texture, and we listen to symptoms that the patient is describing. Then, based on our findings, we prescribe an individualized treatment plan based on the patient's goals. This program may include multi-layer bandaging, manual lymph drainage, exercise, skin care, self-manual lymph drainage, compression, and possibly a pump for longer-term management at home.
So, Michelle, you said when it's caught early, it can be reversed. If not, it has to be managed. So then what are the typical treatment outcomes? Do most patients see improvement?
They do. Compliance is very important. So it's important that the patients do follow through with our recommendations. Our recommendations based on the patient may include bandaging at home, wearing compression, exercising. As long as they're following through with the education that we've provided, they will see improvement in range of motion, increased strength and stability, reduction in swelling, reduction in pain, improved function and mobility, reduction in scar tissue and or cording, and also just an improvement in their knowledge of lymphedema and how to reduce their risk of developing lymphedema in the future.
So obviously, early detection is important. If a patient is experiencing lymphedema, what steps should they take to seek treatment?
Well, if you suspect you have lymphedema or you have any edema that is of unknown origin, it's important that you reach out to your doctor so that they can assess the etiology of your edema. They may need to order tests to rule out other causes. If diagnosed with lymphedema, then ask your doctor to refer you to a certified lymphedema therapist in your area as soon as possible.
Okay, well, this has really been informative talking about lymphedema. Jen, let's wrap it up with you, and thank you both for your time. Is there anything else you'd like to share about lymphedema?
Yeah, thank you, Bill. I just wanted to say that MarinHealth Medical Center has been the primary resource for the treatment of lymphedema and cancer-related dysfunction for more than 30 years. Our physical therapy staff of certified lymphedema therapists are highly skilled, they're experienced, and passionate about providing exceptional and individualized care for all of our patients. We're fortunate to work closely with all of the Marin Cancer Care team of physicians, nurses, patient navigators, and integrative wellness clinicians to maximize the care of the whole person.
Yeah, absolutely, and good to know that. Well, Jen and Michelle, thank you so much for your time. This has really been informative. Thank you again.
Thank you, Bill.
Thank you, Bill.
And once again, that's Jennifer Fernandez and Michelle Haas. And to learn more, please visit mymarinhealth.org. And if you found this podcast helpful, please share it on your social channels and check out the full podcast library for topics of interest to you. This is the Healing Podcast brought to you by Marin. I'm Bill Klaproth. Thanks for listening.